If we hear a sound, what is happening is that there comes a sound signal to the ear, and in the inner ear the sound is converted to a neural signal. And via the auditory nerve, the neural signal is propagated to the brain and further processed in the brain. So, what is happening is whenever we hear a sound, we have some activity in the auditory pathway in the brain. Now, what we find in patients with tinnitus is that there is this similar activity in the auditory pathways of the brain, even if there's no sound outside. What we also know is that very frequently the tinnitus arises when patients have hearing loss. And interestingly, it arises exactly in the frequency of the hearing loss. Let's say we have a patient who has high-frequency hearing loss, so high-frequency sound, high-pitched sound are not arriving in the brain because there's a lesion in the cochlea in the inner ear. That means that the brain realizes there's something missing, and the brain tries to compensate for that by increasing the internal gain, and this may cause some activity in the central auditory pathways even if there's no sound outside. And this is probably the neural correlate of tinnitus.